distinguished guests, esteemed colleagues, dear friends, a very warm welcome to all of you on this Global Fatty Liver Day 2025. At the outset, let me extend a special warm welcome to our distinguished speakers who have graciously accepted our invitation to share their thoughts and vision today. Professor Vinod Paul, renowned pediatrician and member Niti Aayog, who is leading the vision for 2047 for transforming the healthcare in our country. Sri Rahul Singh, Chairman, Central Board of Secondary Education, with the new program of Sugar Board in the school, probably integrating it with school health and kind of making India healthy. Sri Dr. R.P. Joshi, Additional Director General, Health Services, Government of India, I think leading the fight with tackling the non-communicable diseases, especially in view of Fatty Liver Day. It's very appropriate that the NEFRI initiative, initiated by our dynamic Professor Sareen, will see the day soon. Professor Anup Mishra, whom I know for more than 35 years, a colleague of mine, a renowned diabetologist and a nutritionist, who is now chairman Fortis CDoc Hospital, will share how is the connection between diabetes, metabolic syndrome, and fatty liver. And last but not least, Sri Ashok Chakradarji, who has been gracious enough to join us on this occasion. We know that disease, fatty liver, is a menace, and almost, according to one estimate, 30% of Indians have fatty liver disease. And why it is bothering is, it's not the liver disease, but the associated diabetes, metabolic syndrome, and cardiovascular disease which patient may have is going to be a real challenge. So this objective today is that can we prevent this reversible through lifestyle modifications, through diet and early intervention. And we have the power to change its trajectory. Our event objectives today are raise awareness in the society, that is very important, emphasize that prevention by highlighting how food can indeed be our medicine, that is very critical, and foster collaboration between healthcare providers, policymakers, educators and communities for comprehensive approach to tackle this menace. Advocate policy changes, which is very, very critical to support early screening, nutritional education, and implement NEFRI. And finally, empower the community with the knowledge about lifestyle and dietary modifications. As we embark on this journey today, let us remember that every conversation we have today, every insight we share, and every commitment we make brings us closer to a healthier India. This year's theme is Food is Medicine, and it is very, very apt. This doesn't lie in our hospitals or clinics. It is in our kitchen, in schools and communities where one has to intervene. We are truly honored by presence of these eminent personalities who will guide and help us shape this dream in near future. I invite you all to engage in today's discussions, ask questions, share your experiences, and most importantly, commit to become ambassadors to change in your respective spheres of influence. Together we can transform this narrative around the fatty liver disease from one of growing concern to one of hope, prevention and healing. Thank you, and let us make Fatty Liver Day 2025 a milestone in our collective fight against non-communicable diseases. I once again welcome our distinguished guests for their kind presence.